Welcome to this second video on the technical aspects of administering vaccines for prevention. In this video, we'll focus on the actual vaccination process, including hygiene and communication regarding dose, route, site, and needle size. It's important to remember that regional and local guidelines should always be leading in clinical practice. By following the correct procedure and being well educated and trained, any professional can gain confidence through improved competency. Hands must be carefully washed according to local guidelines and procedures, often aligned with WHO recommendations. While some professionals use gloves, hand hygiene without gloves is generally sufficient, and infection risks for cross-contamination are not expected. Just before administration, the professional is responsible for the procedure and must double-check the vaccine's details: name, 0.5 milliliter dose, and condition. The vaccine should be at the correct chamber temperature by the time of administration. Some vaccines come pre-filled for immediate administration, while others need to be prepared. Pre-filled injections may contain an air bubble, which should remain in the syringe and not be pushed out during administration. Check the skin to ensure it is in good condition. Injections should avoid areas with bruises or wounds. If the patient has tattoos, it's best to avoid injecting into inked areas. The angle of injection should be adjusted based on the patient's condition, which may differ for children, the elderly, or individuals with different body types. For influenza and COVID vaccinations, inject into the deltoid muscle at a 90-degree angle. Only a few vaccines require a 45-degree angle, and very few are administered via nasal spray. For intramuscular (IM) injections, use a 22 to 25 gauge needle. The needle length and injection site should follow local guidelines: 5/8 to 1 inch for smaller individuals and 1 to 1.5 inches for those with more body tissue. Clean the skin with an antiseptic substance using a single stroke. This is sufficient as vaccination is not a sterile procedure. Administer the vaccine gently but firmly into the arm, and after completion, withdraw the needle in one smooth motion. Place a small plaster on the injection site. After the injection, immediately dispose of the needle and ampule together in the sharps container. Ideally, this should be done with one hand to avoid accidental needle injuries. This practice ensures safety for professionals and complies with the European Directive on the Prevention of Sharp Injuries in the Hospital and Healthcare Sector, signed by European social partners. Provide an explanation of disposal regulations, including sharp needle handling guidelines. With administration, be aware of the right vaccine, right dose, right route, correct site, needle size. See the next video for aftercare and procedures. This video was made possible with support of Henelux and Fine, supported by an educational grant by Viatris. This was an ESNO production.